Jason just started it. Sounds like you just started it, Jason.
Hey, good evening, everybody.
Jason, I'm going to need you to read me.
Hi, everyone. Good evening. Just bear with us for a minute or two, having some technical difficulties. We'll be starting momentarily.
Can you read?
I think Kay's trying to log in now, Stephen John. She doesn't have power at her house, so.
Oh, is power? Oh, I guess you're not in Dover right now. I'm just curious if power's out other places in Dover.
One of you guys may have to step up in a chair just in case.
Happy to do that. Should probably give her a few minutes. Did she send you a text message? Is that how you know, Jason?
Yeah, actually, we were just on the phone. That's I was trying to walk her through getting into it. So I'm actually logged in as our Board of Health Zoom account. And it's up to you guys. We can get going if
we can give her a few minutes.
Yeah, no, I was just saying it's up to you guys. We can just get into it if you want to open the meeting. I don't want you to feel like we have to wait. I know there's a few folks on here who have to get out of here. So
Why don't we give her 4 more minutes and then we'll start, just so we don't inconvenience anyone else. But look like everyone else at least has power. But I guess their mere presence here is an indication of that. right, so 2 more minutes. Again, apologies for making people wait.
Hi, everyone.
Hey, Kay.
Hi, John. Who else is there? I am on the phone. I can't see anything.
I'm here, Jason is here, Suzanne Hiltz is here, our other board member, Stephen Kruskal is here, and then we have 3 visitors from the public. I will not attempt to say anyone's name so I don't mess them up. We have one gentleman, Arthur,
Okay.
with only a last name, but we have 3 people who've joined us.
Okay. Unfortunately, the power is out where I am, and I can't get into the meeting on Zoom for some reason on my phone. So I'm going to have to do this blindly.
So Kay, can you get text messages, Kay? Because I can paste the agenda into the text.
Oh, that would be fantastic. Yeah. Although I can pull it up in an email, but yeah, why don't you put it in a text message? That would be
All right.
easier than
I'll do
email.
that for you.
Thank you, John.
So do you want to start with the roll call?
Yeah, let's do the roll call. Kay Peterson, board chair, present.
John Quackenbush, board member, also present.
Steve Kruskal, board member, present.
All right, and I just sent you a
Okay.
text with the agenda.
Okay, thank you. So I would like, so we'll begin with a public comment period, but before we do that, actually, I'd like to find out whether any of the participants other than people on the board or who work for the board are here for a specific agenda item later, or whether they all want to do public comments. Could those of you who want to speak at some point during the meeting, please let us know whether you want to speak now in the public comment period or later in the meeting.
If I could just
Jason,
jump
could
in
you-
quick, Kay, Anya, our intern, is here, so she is with us. She's just here observing this evening.
Okay,
She was with us for the first time on Monday for a few hours, and she'll be back with me tomorrow afternoon. So just want to welcome her aboard, and very excited to have her.
Well, I'm glad I
Well,
didn't
great.
try to
Well-
pronounce your name, Anya. But thank you very much for joining us, and it's very nice to meet you in person, sort of. Sorry, Kay.
Anya, Anya, I'm really glad you're working with us too. So you're a student at, is it Northeastern, or I've forgotten which college?
Regis College.
Regis College, that's right. And you're, how long were your internship before?
Until mid-December. It's my second or my last internship until I graduate.
Great. And what is your major?
In public health, and I minor in nutrition as well.
Minoring in nutrition, you said?
Yeah.
Great. Well, so glad you're here, and feel free to ask questions during the meeting if you have any. And I hope to meet you soon, and at the next meeting, I hope to see you, and hopefully I'll be on Zoom.
Thank you.
Now, thank you.
And
Jason,
Anya,
who else is here?
I'm a professor at the
Okay.
Harvard School of Public Health if you ever want to talk to me about things you can do after you graduate.
Oh, that's so awesome.
Sorry. Jason, Kay was asking about other people who were here.
Yes, so I see Arthur's here. Thanks for joining us, Arthur. Arthur was interested in discussing PFAS. He had reached out to me about a month ago, so I extended the invitation to have him join us this evening. And also here, and I'm so sorry if I mispronounce it, Suhani from Harvard. Just wanted to speak to us for a couple minutes at public comment, just to kind of go over what her and I had discussed this week regarding a Narcan opportunity.
Great. So, and that accounts for everybody who's at the meeting then? We've,
Well, can't forget Suzanne. She's with us, but
hi, Suzanne.
Hello.
Okay, so why don't we begin then with either Arthur or the Harvard student whose name I missed, but
well, so Kay, if I may, the PFAS discussion is actually on the agenda. The
Oh,
discussion
okay.
regarding the Narcan and the Suhani is not on the agenda. So if we could just allow her to speak for a minute or two at for public comment, we should definitely do that first.
terrific. Okay, Suhani, would you like to begin?
Yeah.
And I would imagine you'll speak for less than 5 minutes. Is that what you're targeting?
Awesome. Yeah, thank you so much. Thank you for allowing me to be here today. My name is Suhani. I'm an undergraduate at Harvard studying neuroscience and global health. And I reached out to Mr. Belmonte because for the past 9 months, I've been working on an initiative alongside Dr. Scott Weiner at Brigham and Women's Hospital to increase naloxone education among high schoolers in Massachusetts. This is an effort to get more students trained on how to use naloxone in the situation of an opiate overdose. And we're currently in collaboration with around 70 counties or 70 cities in Massachusetts, trying to work this semester to get naloxone training in their school buildings for high school students. And the reason why I reached out is because I would love to bring this to Dover as well and be able to train students on how to use naloxone. We've developed a curriculum that's about 15 to 20 minutes in length that teaches students about opioids, the opioid crisis, how to recognize signs of opioid overdose, how to use naloxone, and where to find naloxone in their community settings. So it's a pretty comprehensive curriculum in line with Brigham and Women's Hospital and the national organization, the Naloxone Project. So just wanted to share this with you and hope that we could maybe collaborate with Dover in the future to get this training into the schools.
Thank you. Does anyone have questions?
I just want to
I
say,
have
I just want to say thank you for taking up this initiative. You know, I think it's a really wonderful thing you're trying to do. You know, we just sent my son off to college and we packed him up a little naloxone kit, not anticipating that he will ever have to need it, but in case it can be a real game changer in terms of keeping people alive and hopefully getting them into the treatment they need. So thank you very much for taking the initiative and trying to bring it to our town.
Well, I must say that we have a naloxone set up in the Board of Public Health office. We've made some attempts to distribute it to wider places in town, and I guess that got stalled at the town administrator level. But our intent is to have naloxone in a number of other public places, including the schools. But
yeah, providing education on how to use it, even though it's simple, I think would really raise awareness tremendously. So.
Yeah.
I agree. Have you worked with any schools around here recently, or have you already begun to work with schools?
So the schools that we've actually piloted the training in are mainly in Middlesex County, but we are in collaboration with schools across this. We are talking currently to schools across the state, Western Mass, the Berkshires, Norfolk County, Hampton County, so really everywhere. But our previous efforts had mainly been focused in Middlesex, so we're just trying to expand.
Yeah. And how have your pilots gone?
So far, they've been very well received by students and staff. We collect feedback from students, and they've really enjoyed it. They found the training to be very informative and also felt like they felt very empowered to save someone's life during an opioid overdose after receiving the training. And staff also were really excited by it and happy to have us either come in or like deliver the training. So it was well received for sure.
Great.
Suhani, let's definitely continue our conversation offline. I already have a message out to a contact at the school just to kind of, I wanted to put the feelers out and just see what they thought about the idea. So more to come. Board can't really deliberate on it because it's not actually on the agenda, but from what I'm hearing, it kind of sounds like everyone is in favor of partnering on this. So let's definitely stay in touch offline and see what we can figure out.
Yeah, sounds great. Thank you so much.
Thank you. Thanks for joining us, and thanks for your patience.
Thank you very much.
Thank you very much. Okay, so John, the agenda has not come through. Your text hasn't come through because I also have pretty poor cell service here. So
All right. So I'll tell you the next agenda item after public comments was just an announcement that our next meeting is November 4th. It will be at 6:30 again. That was item 3. Item 4 is just
well, wait,
approval-
before you
Oh, go ahead.
move on, does anyone have any problem with November 4th?
Nope.
I don't either. John, is it okay for you?
Looks good to me.
And Suzanne and Jason?
Works for me.
Looks good.
Okay, great. Sorry to interrupt you, John. What's next?
After that, it was approval of minutes, and I'll remind everyone that Suzanne sent the minutes around. So we should have all had a chance to look over them. And they're minutes from 2 meetings, August 30th and September 9th.
So let's start with August 30th. Now that I can look at. So I had one suggestion. There's a sentence that needs a little clarification for the end. Let me find it. Sorry. Now I'm having trouble finding it. Did anyone else find just a sentence that needed a little clarification and toward the end of the minutes from the
I
30th?
sent that along to Susan. I would assume that the amended minutes have that. It was in the last full paragraph. Of page 2.
Oh, yes, that's it. For me, it's the sentence, Fresco questions if the board has heard from the board's legal representation, has confirmed if the complainant has any standing. So that sentence, there's
Susan has a solution to that. She could read it if you haven't seen it in print.
yeah. Do you want to read that, Suzanne?
Yep, it's Crisco asks if the board's legal counsel has been consulted to confirm whether the complainant has any standing.
That reads really well. Okay. That's my only suggestion about these minutes. Anybody else have any more?
Oh,
The only thing I saw.
Okay.
So I moved that we approve the August 30th, 2024 minutes as amended.
second.
All in favor? Aye, Kay Peterson.
Hi, John Quackenbush.
Hi, Stephen Kruskal.
Okay, we're done with those. All right, now, 9 minutes. Are there any suggested changes? Hearing silence? Means
I didn't
everyone's
see.
okay with them?
Yep.
So I move we approve the minutes from our September 9th, 2024 Board of Health meeting as presented.
Second.
All in favor, I.K. Peterson?
John Quackenbush.
Stephen Kruskull.
Okay, great. Now, is PFAS the next item on the agenda?
It is.
Yes.
Great. So why don't we proceed with that? Jason, do you want to introduce our guest?
Yeah, I know I already kind of set the scene a little bit a few minutes ago, but just a quick recap. So Arthur had reached out maybe a month or so ago, had a question or two about PFAS. I thought he brought up a couple of really great points, so I had the idea of putting it on our next agenda for discussion. And I extended the invitation for Arthur to come speak if he wished. I'm not positive, but I believe you prepared some materials, Arthur,
Yeah.
to present.
Yes. I probably need
So
about 7-8 minutes, if that's okay.
yeah, is the board okay with that?
Fine with me.
Yep, sounds good to me too.
Thanks so much for the opportunity to speak and for the important work that you all do. I'm going to share my screen.
Hopefully you're able to, Arthur. I'm hosting the meeting, so I don't know if I have to do
Yes.
anything special to allow that, but you should be good. There you
Okay, let me know. Can you?
Perfect. It's up. We're seeing your
Yeah.
presenter screen, not the full screen version. But
Okay, how's that? Can you?
Yep.
Okay, great. Thanks very much. So to say a little bit about myself, my family and I have been living over at 23 Hartford Street for just about 10 years. It's going to be 10 years later this month. I'm a physician and a neuroscientist. I work on neurodegenerative disorders over at Takeda. And yeah, really interested in speaking about, what my family has experienced. And also maybe if I could just provide a little bit of kind of scientific insight into what I think, why this is important. So what I'm showing here on the first slide is a water testing report from our home from July the 10th. And we work with a company called H2O Care that's been taking care of our water system. And they just did this test for the first time for PFAS. And what I did here is I just color-coded the results, and you can see that a number of the analytes are significantly elevated over the laboratory's reporting limits. The most concerning analytes were something called PFHXS, which was 16.2-fold over the reporting limit for the lab, as well as the sum of 6 particular PFAS analytes, which were 21.8-fold over the reporting limit. I should have said in the beginning that these samples were taken from raw well water that before any kind of it had been through any of the water systems in the home. And these were all done carefully per protocol from the laboratory. What I've done here in this slide is some of you may be aware that the EPA has designated 6 PFAS analytes as being of particular concern, and they have set legally enforceable limits for these analytes. And what I've done is I've mapped the results that you just showed onto the EPA's designations, and 2 of the analytes are within the legally enforceable range for EPA. namely the PFOA and the PFHXS analytes, which were both over the enforceable limits. And I can share these slides with you, and includes the references to the documents I'm referring to. I just wanted to, on this slide, just communicate a little bit to you all what a burden this has been to us as a homeowner, not just this issue, but other water quality issues. So our well water has a lot of sediments, which is an issue. The sodium levels are twice the reference level. And this is not without health consequences, given the cardiovascular effects of elevated sodium intake. Our radon levels are very high and require mitigation. And there's also a lot of minerals in the water. So we have spent at least $15,000 already on water quality mitigation because of these issues. And the newly discovered PFAS issue led to an estimate of an additional $8,000 to install filters to mitigate that. And again, that was from a company called H2O Care. Now, I just wanted to quickly, if I could be allowed to, just say a little bit about what my opinion is on the medical consequences. I think it's quite concerning. So, as you may know, the National Academies of Sciences, Engineering, and Medicine has a consensus report on PFAS where they suggest more extensive testing and follow-up. And in their view, there are several adverse health outcomes that are reasonably likely to be associated with elevated PFAS levels, all of which are quite concerning. Effects on immune function, effects on lipid levels, including things like cholesterol, very concerningly impact on infants and fetal growth, increased kidney cancer, and then suggestive evidence of a number of other things: breast and testicular cancer, thyroid disease, ulcerative colitis, gestational hypertension in pregnant women, preeclampsia also associated with pregnancy, and liver enzyme abnormalities. In our case, the analyte that was most elevated, PFHXS, has an extensive literature in man, consistent with what we just saw, and also, in my view, as a scientist, as a biologist, the studies in animal models, I think there's always going to be potential confounds in any studies that are done in man with non-randomized kind of data. But in animal models, we can really very rigorously control the experiments. And there's very clear evidence, in my view, for the effect of this molecule on things like metabolism, development, fetal development, things like cholesterol levels and so forth. So, I think quite concerning. So these are my views of just some things that I think should be considered. I think this is a really important issue and has to be addressed. And again, I've been living here. We've been living here for 10 years. We have 2 kids, and we're just finding out about this now. So who knows how long this has been going on? But I think testing I think residents in Dover need to be aware. They need to test for this. And I would suggest that people should share the results with you guys, because I think we need to be in this together. We need to help each other out. And I wouldn't be at all surprised if this is sort of a Dover-wide issue. And finally, I think that given the number of water quality issues, the burden of needing to test and just one test isn't good enough. We have to retest and test and test because things could change. We don't know where this is coming from. I think the burden on homeowners to ensure the quality of their water is way too much. I think that people in the town need city water because then we can have a centralized approach to testing And that would be the best way to guarantee that all of this folks in Dover have safe drinking water. I think it's just too much to ask individual homeowners to manage something this complex and with these types of consequences. So with that, thanks very much for listening.
Thanks, Arthur.
Thank you. So you're going to share your slides with us, is that right?
Yes, of course. Yes, please let me know who I should send them to. Jason, could I send them to you? I'm sorry, you're on mute, Jason.
Yeah, that's probably easiest since we've already, exchanged emails and everything.
Yeah.
I can get it out to the rest of the board.
Okay,
Who
will
did
do.
you use for your water testing, Arthur?
Give me a second. Let me just review. H2O Care were the ones that actually drew the water testing, that drew the water, but they sent it over to Absolute Resource Associates at Middleton, MA.
And that they're the ones who did the PFAS testing?
Yes.
I just want to confirm, you have a private well, is that correct?
Yes.
Are you aware of anyone else in town who has had PFAS testing done?
Not directly, but I know that the H2O Care company, I think David Rambaldi is the owner. He told me that they have tested a number of wells in this area, and that they've come up positive very frequently. But I don't have more detail than that.
Where the voluntary fire department used foam for training, the areas around that, those sites have tested positive for PFAS.
Steve, do you know where they did that training?
I did at one point. I can't specifically recall with absolute certainty, but that was actually, that came out either in local news or some sort of publication.
Yeah, so we might be able to find that. So,
and it is a concern.
Go ahead.
And it is a great concern. I thought the solutions for eliminating PFAS were a lot easier than the 5-figure number I've seen on the screen just now. There's supposed to be a device that can be installed under the sink for about $300 and solve the problem. But we need to do a lot more research into this.
Yeah, the issue with the under sink approach, it is true that there are systems of that sort, but the problem is that we use water, for example, in the bathrooms, when you're brushing your teeth, maybe taking medication, and so forth, washing dishes, dishwasher, so I know that the advice that we were given from David was that it really is best to have a whole home system.
Arthur, if you don't...
Is that a reverse? Go ahead.
Go ahead, Kay, sorry.
Go ahead.
I was just going to ask Arthur, if you don't mind sharing, I don't know if you mentioned it in one of your slides, but what was the cost of the PFAS testing itself? Do you remember?
Yeah, I'm very happy to share that. I think it wasn't cheap. I think it was about $400 or $500. But I can confirm for you. Maybe I'll put it in my email too with the slides.
Thank you.
So is your whole house system a reverse osmosis system? That's my understanding of the systems that are put under the sinks. Do you know what you have for the whole house?
We haven't installed the system yet because we've had a lot of problems with water pressure because of all these things that we're trying to get rid of in our water, and So we have a kind of a bit of a larger problem at this point. But reverse osmosis is one of the options. There are some some filters, other types of filters that can also remove it.
And
Okay.
Arthur, how deep is your well? You know?
I don't know, but I'd be happy to look into that.
Yeah.
I'm just curious. We used to live in the center of town, at 12 Walpole, and we had when we moved in an old well that had been hand dug in the 1930s. So it was only about 30 feet deep, and we at one point we ended up having the water tested, and there were all sorts of things. We learned there had been a leak at the mobile station in the center of town years ago, and we ended up having to drill a new well, and the water quality was much better as the well got deeper. You know, I don't know what the aquifer looks like out in Hartford Street. I mean, yeah, there are lots of questions about this. We'd have to get answers for before, you know, it would even make sense to sort of discuss this at the level of a town meeting, because that's ultimately, if you're thinking about trying to push for a, you know, townwide water system, that would be creating a whole infrastructure.
Mhm.
And we need a lot more information before I think the town would even consider it.
If it helps, our home isn't that old. It's I think it's around 15 years old at this point, so the well isn't that old either. But I don't know the depth.
Did you have testing done when you first moved in, or what motivated?
Yes.
And there wasn't.
Well, PFAS was not tested for. They tested for radon and E. coli and all the other usual things, but not PFAS until now.
And what
Do you have-
motivated you? Oh, go ahead, please.
Do you have a deionizer in your home?
No.
Because deionizers add to the sodium content of potable water. And it's over pretty much generally, sodium has been elevated in well water, somewhat attributed to salt use on the roads in the winter. But the deionizers actually add to that burden.
Okay.
So, Jason, you obviously see the water testing results when properties change hands. Do you ever see PFAS testing with those? I would guess not, but
It's a
I'm
great
wondering if-
question. I could probably count the number of times on one hand that I've actually seen people do it.
And do you recall what you've seen in the way of results?
Mixed. Some high, some low. It really depends. I mean, obviously it depends on the area of town too.
Yeah. And do you think we have a way, an efficient way of searching for those properties that have had those reports? I'm guessing no, but I'm wondering.
Actually, probably yeah, because most of them would be in my email, so it would just be a matter of pulling them all up individually.
Oh,
But
great.
it's certainly something where we could start tracking more formally, so we have more of a data sample that's just readily accessible, you know.
If we had an intern
think
going through the data, would be a really good project for us.
Right?
That would be a great project for an intern. Do we have an intern?
Well, no. So I mean, I guess the natural question to ask at this point is, do we need to take a serious look at our well regulations? And I think the answer is probably yeah, we should.
Yeah.
You know, water testing is required at the sale of a home. It's required prior to a new well going into service. But there's, of course, no mention at all about PFAS. Our regulations are relatively new, but you know, even in the last 10 years, a lot has changed.
Yep.
So, I think it's a matter at this point of maybe taking a good hard look at that and seeing what we can do to help this situation. Because yes, to Arthur's point, ideally we would have town-wide water, because public water it's a totally different ball game. It is monitored 24/7, treated. Whereas, well water, you are legitimately just drinking water straight out of your ground and hoping for the best. So if there's a better way where, we can do our part and manage this whole thing, I think that would be the goal at this point. Even if just for the time being, maybe we even just start recommending that people PFAS test before we get something official on the books.
It might be interesting to think too about, I don't know how much money we actually have, or whether we'd have to go to the selectmen or the town meeting, but potentially to do a survey from different sites around town just to get some idea of what the distribution looks like.
So this would be a great use of the monitoring wells, which are
Yeah.
scattered around. I don't know if there's one near Hartford Street or not. Does anyone know offhand?
Nope.
Not sure.
Not sure, but we could figure that out. But I just wanted to talk about other PFAS results that I have heard about. So I would say, Steve, you probably remember this, that early in the pandemic, so maybe 2020 or so, there was the DEP was encouraging people in towns where there were a lot of private wells to encouraging people, the towns to try to get people to test their water for PFAS, and the DEP was offering free testing as an incentive. There was a small number of people in Dover who did the testing. I don't remember how many, but I would guess fewer than 20. And all of the results were normal except for one house. One well had a very slight elevation, and I don't know which compound it was. I don't know, but we could look into that. We could talk to somebody at the DEP and see what kind of results they had for Dover as another way of getting more data. Steve, do you remember anything more about that?
No, it might be in the minutes if one did a search, and the other resource who might have some memory of this is Mr. Clark.
Yeah, let's pursue both of those.
So I just did a quick search, Kay, and there's actually a program from the DEP that offers free testing to individuals who apply for it in communities where at least 60% of the residents use private wells for drinking water.
So that program is still going on. That's exciting.
Yeah, so it's something we may actually be able to take advantage of.
Yeah.
Sorry, it's a little late for your $500 fee, Arthur.
But this would be addressed something else I was thinking, and that is, I wonder, Arthur, if have you thought about retesting?
Oh, I'm sorry.
lab?
I'm sorry, Kay. Apparently, I may have misspoken. It seems like it may have ended. I'm looking further to see.
But Kay, in terms of retesting, I think that is a good idea. We haven't done it yet, but I think it's a good idea.
Yeah, and maybe with a different lab. I don't know the landscape here, but it would be. Maybe we should talk to somebody at the DEP about their program. I think we could find our minutes and learn the names of the people who are involved in that, we could cold call the DEP. Jason, do you have a contact there who's interested in water?
I could certainly find one out.
the name Claire Golden is coming to my mind. Is she interested in water, or she's more of a septic person, isn't she?
She's more of a septic contact, I believe.
Yeah. Well, I certainly have some, I could come up with some names, and I bet Steve is right that if we do some searching of our old minutes, we'll come up with some names and some information about that program. So maybe, Arthur, if you're thinking about testing again, you might want to wait till we figure out whether the DEP is still offering free testing.
Yeah, they're not offering free testing. I'm sorry, I misspoke. It ended in 2022.
You got me so excited. Well, but I think it's worth us calling them and just asking and seeing if there's something in the works or some, maybe. I think that we're not the only community that has this concern, I'm sure.
So there are actually results from the pilot program in 2022, and there were 16 wells that were tested in Dover. They don't have any information about where in the city they are, but where in the town they are, but there were 16 wells.
Okay. And they don't have the results either? Did they say what the results were?
They do have the results for those 16 sites.
Would you mind forwarding the link to what you found maybe to Jason, and he can put it together with what Arthur is sending and get it circulated?
Sure. I put it in the chat, Jason, and I can email it.
Thank you. Yeah, so I guess at the very least, this is a great starting point for us, and we kind of have a direction we can start working in at this point. Start getting some more messaging out there and seeing where we can go with this whole thing.
All righty. Does anyone have any other comments or questions for Arthur? We really appreciate you coming, and this is not the first time we've thought about PFAS and talked about it, but I think you've really given us a good push, and it's helpful to know that you've had such elevated levels. I would say this is the first incident I've seen in town or heard of in town in which there are really very concerning levels, but there probably are other places as well where PFAS.
Well, thanks.
PFAS results in wells are good, are high.
Thank you for listening, and if there's ever anything I can do to be helpful, I'm very happy to do so.
Thank you. Does anyone have any further questions, comments?
Arthur, do you have any interest in chairing a subcommittee such were created?
Yeah, I'm happy to.
Steve, can you?
Yeah.
Great. Okay, thank you.
Thank you so much, Arthur. Great to meet you.
Thanks, everyone. Bye.
Okay.
Thank you.
Bye. So it sounds as if we have some information to gather and then more discussion to do. So we move on to the next item on the agenda?
Please.
And what is that?
Good question. Mosquito update.
Okay, mosquito update. So shall I go ahead, or do you want to, Jason?
No, you go ahead.
All right. So because of the concerns about mosquito-borne arbovirus infection, someone, Beth McCoy, the superintendent of the schools, reached out to us and to the Sherburne Board of Health. And that resulted in a meeting of representatives of the schools and each Board of Health to talk about strategies for dealing with it. And because the risk levels are not particularly high in our towns relative to some others around, we didn't recommend any dramatic changes, but we did brainstorm a list of actions we would take if the risk level did jump upward in either town, having to do with changing the time of games and other outdoor activities, elimination of standing water, if there is any on the fields or near the fields, and there were several others which I can't remember right now, but those were the big ones. Anything you would add, Jason?
No, I mean, I think you pretty much covered it. We had a really great meeting, I thought. A lot of great ideas. Obviously, no action really needs to be taken at this point. Not much has changed in terms of the risk levels. I believe Triple E is still low. West Nile virus is still moderate for Dover. We just kind of wanted to come up with a game plan just in case, this all of a sudden shifted to something really serious. We just wanted to have at least a game plan in place in case, needed to move football games up or change things around or things of that nature. So it was a really good, positive discussion, I thought. A lot of good ideas.
I would agree. Any questions about that topic?
I'm curious in terms of, since, I'm sure you discussed this at the meeting, in terms of action items, what were the major suggestions they had? Was it what you already mentioned, Jason, changing the times of games, or, they talk about spraying, other mitigation effects?
Well, we talked about messaging to people about insect repellent, possibly having insect repellent available at games and practices in case students hadn't used it. I don't remember other strategies. Well, one would be to actually, instead of, so there are Friday night games. That's the only day night activity. We talked about the possibility of moving those games to the daytime if the risk increases.
Where you'd have to, potentially balance the mosquito risk against other risk of playing in higher temperatures. Right.
Yeah, not an issue in the fall.
Yeah, I guess that's true.
It's getting cool. But I was impressed with how, first of all, they reached out to us, so they're interested and they seem quite responsive and collaborative about the discussion. The acting athletic director was there as well, which was helpful. All right, anything else about that? So we go next item then? Whatever it is. Oh,
the next item, Kay, is the associate board member update. So I'll pass that to you.
okay. So I just want to say, John, your text to me just came in.
I'm glad it was timely.
Yeah. So I want to talk about the associate board member initiative. So Jason and I talked to Nina Pickering Cook about this, and she said that to add an associate member to the Board of Health, this would be a non-voting person, but someone who could participate in discussions. We would first need to petition the legislature to allow us, through a home rule petition, to allow us to do this. And so step one would be at, say, the next town meeting, we ask town meeting to, I'm not sure I can even get the terminology right, but to proceed with a request to the legislature for a home rule decision about an amendment to our bylaws. If that made it through the legislature, then a year later, at the next town meeting, we could then put a bylaw on the warrant about the associate member. So it's really it's at least a year and a half process because it requires 2 town meetings. Apparently, it's not difficult to get the legislature to agree to something like this, but it does require somebody paying attention to it and making sure that it doesn't get, that our issue doesn't get ignored if we do the home rule petition. So anyway, it's not insurmountable. It's just a little onerous, I would say. If we want to proceed, the next step is to draft a bylaw that Nina would then review, and then I'm not sure what the next step after that would be, but she would advise us about that. Any questions or comments?
Yes, I'd like to hear a presentation regarding the necessity for this. I'm not necessarily on board with this initiative.
What's your concern, Steve?
I don't know. I haven't looked into this sort of phenomenon in the past, but I don't think it should be taken on willy-nilly without some consideration and some time for each member to consider this.
So I'm sorry I interrupted, Kay. You were going to say?
Oh, that's all right. I was just going to summarize the rationale for considering this, what I would consider the advantages of having an associate member. So there are at least 2 other boards in town that have associate members, the Planning Board and the Zoning Board of Appeals. Anyone know of any others? Oh, you know what? I may be wrong about the Zoning Board of Appeals. The Conservation Commission and Planning Board are the 2 that I'm sure of. And the associate membership allows the board to have another person who's involved in taking on projects, being able to, depending on how the bylaw is written, being able to vote if there's a member who's absent or if there's not a quorum. And it also is a way to have people who might be interested in running for a Board of Health position off in the future to sort of test the waters and see what they think about it. So that's the rationale from my perspective.
Yeah, and is this an appointed position or an elective position?
Well, that's an excellent question. It could be an appointed or it could be elected. I believe that we could decide how we wanted to do that. The planning board appoints theirs. I don't know what the Concom does. I suspect they appoint theirs as well because no one on the Concom is elected, but the planning board members are elected, but they're able to appoint their associate member.
Well, that bears a little further investigation.
What do you mean specifically?
Well, I think that the appointment process might not be as democratic as an elective process for that role. And
Mhm.
I do have, in this case, certainly democratic tendencies regarding it.
Well, this would be someone who would largely be volunteering to work and do things
Well,
without.
it may well be, except Kay just mentioned that there would be situations when that person would have a vote.
When would they have a
If
vote?
we
Kay?
want- Well, they could if we drafted the bylaw that way. I think that on the planning board, the associate member can vote if, I don't know, I shouldn't speak because I don't really know, but this is something we could explore with, how, I'd like to see what the other town boards do, and we would have to decide whether we wanted to allow the person to vote or not, and whether we wanted the person to be appointed or elected.
Because, if I would tend to think appointing somebody as an associate member would make sense. If we're going to give them voting rights, we might as well, consider expanding the board to 5 people, which in some ways would make a lot of sense too, because that would give us the opportunity to have, groups of people meet and have subcommittees without violating the open meeting law.
I find that far more preferable, and that's an interesting concept.
Yeah,
It
it's
sounds
just
like
not
the same amount of effort would be required.
Steve, I had interrupted you. Can you say that again? Because I only heard
I
part of
find
it.
that far more preferable as a possible step, and it sounds as though the same amount of effort to effectuate it would be required.
So my concern is that a lot of boards are having trouble finding enough people. And John's laughing. Why?
No, that was going to be the next thing I was going to say is the only problem is we'd have to find 2 people who'd be willing to run besides the 3 of
Yeah.
us.
So part of my thinking about this is that if we had an associate membership, that would be a way for a person to put their toe in the water with the Board of Health without committing to becoming a voting member and a 3-year term and running for office. Appointing a person would make it easier for them because they wouldn't have to run. I'm not saying that appointing versus electing is necessarily the best thing, but one of my I guess one of my big motivations is doing our best to try to stimulate interest for people in the Board of Health down the road. And the idea of having 5 just seems
That's true.
really like a terrible burden.
Well, in terms of stimulating interest in the doings of works of the Board of Health, taking on more projects that were more apropos, especially PFAS for one, and maybe others, might be the way to stimulate more interest. I think if we go down the road with PFAS, an awful lot of people are going to end up being concerned and paying attention to what the Board of Health is doing about it. If indeed the Board of Health is allowed to deliberate and take on that project.
Well, but somebody like Arthur would be a great example of a potential associate board member who could, be recognized in the town for doing this kind of work. The other person who immediately comes to mind is Moji, who does all the vaccine clinics. I mean,
Yeah,
he might be a great Board of Health member at some point in the future, and getting him involved could be a great way of pulling him in.
well, again, at this point, I prefer either expanding the board or going the elective route on this rather than the appointed route.
Well, what do you think of as a next step? I learn more about the associate members of the Concom and the planning board and how that's structured. And then bring it back to our next meeting and talk about what they're doing. And then we could talk about pros and cons.
Yeah, it sounds like a great plan, Kay.
Steve, you okay with that?
Yes, though the idea of expanding the board to 5 members, if we adhere to the restraints of the open meeting law, seems a very attractive proposition. I mean,
there are things I like about it, but I also really share Kay's concern about trying to make sure we have a full board then. We don't have a huge town.
Would be nice to be able to see 2 of you guys in the same room.
That is true. This is
What do
the
you mean?
weirdness of town governance in Massachusetts, Anya, is, you know, the open meeting law means that any 2 people are a quorum. And so we
Yeah.
can't really discuss any business, even if Jason is there.
well, the reality is it's honored in the breach quite a bit. I mean, Bob Springett's memorial service, Robin reminisced about her weekly meetings with Bob at some offsite place that went on for years, and she openly discussed that.
Wow. With Nina Pickering Cook there. All right. So, all right. Why don't I plan to discuss what the other boards do, and I'll prepare something for the next meeting. We can talk more.
Right.
All right.
You know, now that your husband is on the capital budget committee, Kay, you know, I can
Yeah.
wink at him and send him secret messages.
A secret way of communicating.
Exactly.
Okay, so let's move on to old business. Are there any old business items that people have?
I have none.
No,
I have none. Jason?
A few quick tidbits. I talk to most of you guys, you know, individually pretty consistently anyway, so you guys always know what's going on for the most part. So not much in the way of updates. I had Suzanne reach out today to set up a few interviews for our nurse position. So hoping to do those in a couple of weeks. I don't know that Suzanne has heard anything back yet, but so 2 candidates we're hoping to interview coming up. New plotter has arrived. That's very exciting. For the better part of the last year or so, our existing plotter was pretty much always broken. So made for a very frustrating time in the office. Very embarrassing when a resident walks in and asks for a copy of something, and you have to say, I can't because my equipment is broken, because it's always broken. So hopefully we no longer will have that problem. That was it. Just wanted to give an update on those 2 things.
What about the goats?
So on that, we're just waiting to hear back from town council with some more info for us just about the whole situation. I haven't seen that yet, but it was supposed to come sometime this week from Nina's office. So once we have that, more than happy to share.
It turns out that in Nina's firm, there is an attorney who specializes in municipal law and farm animals. So he's going to be writing us something.
Well, I was at the Springdale Field Festival thing on Sunday, and Goats of Dover was running a petting zoo that was very popular, which I thought was interesting.
I imagine it was very popular. I once went to a birthday party, someone's 60th birthday party, and Goats of Dover were there for the 60th birthday party, and they were quite a hit.
Flu clinic, I just wanted to mention, we have close to, I think it was around 90 or so, Suzanne, when I left the office earlier. So it's been a pretty good turnout so far in terms of signups. So we should be ready to rock and roll for that next Friday. I don't know what the weather situation is at this point. It's still a little too far out to really have a good idea. But we will have a rain plan just in case. There's a few tents and whatnot available. So, we'll do what we have to do. But knock on wood, hopefully the weather is just fine.
Well,
yeah, looking forward to that.
I sent Suzanne a private message, and I'll say this publicly in the meeting so that it goes in the record. But Suzanne, you really did a phenomenal job pulling together the sign up website and managing the whole process. So you deserve a tremendous amount of credit for pulling that all off and pulling it together.
Thank you.
Agreed. She's been a rock star with it, and I would have been a mess without her. So,
Oh, thank
so
you.
excellent job on that.
Thank you, Suzanne. Really great.
And I've done it in the
I'm
past,
curious-
and you got the time slot elimination to work. So
Yes,
bravo to
one
you.
has been filled so far, and it's off the Google form. So
I saw that today. So
yeah.
great.
So just curious, what was the most popular time that you had to pull off the form?
It was the first time, 10 o'clock to 10:15.
Uh-huh.
And I think like a group of them all signed up at once, and every single one of them is all getting the same exact thing, a high dose with a Moderna. So it's funny how
Huh.
it turned out.
Well, it'd be easy for
So
Moji.
some-
He only has two 2 vials he has to open up.
So how many people are signing up for COVID vaccine? Any sense?
I would say maybe like half, or maybe like 60%.
That's
Actually,
terrific.
maybe closer to half.
That's really good. All righty. Anything else about the vaccine clinic, Jason?
No, that was all. Just wanted to give an update on that. Let you all know where we stood. Seems to be going along swimmingly with the signups. So I thought we had a really good system in place last year. Everything ran very smoothly. So hopefully we have another year of that this year.
It occurred to me, so 2 years ago, Chief McGowan wanted us to have a detail at the event, and then it turned out to be so well organized that it really wasn't necessary, and he agreed with that. So in 2023, we had no police detail. And I wonder, since the new chief we've never talked to him about this, whether we should just do an FYI conversation with him about it and let him know why we're not asking for a detail, and be sure he's heard about it. What do you think?
Yes.
Yeah, it's a good idea.
All right. So, any other old business items? Then I will entertain a motion to adjourn.
So moved.
Seconded.
Okay, the time is 7:47.
All right.
All right.
Stopping the recording.
Okay, good night, everyone.